The vision we have for the Department of Medicine is to really work on all of the facets of an academic department. Clinical care, of course, is paramount, and patients come first, and we want to practice best practice, evidence-based medicine. We want to have our clinicians delivering the care that's just right for our patients. But in addition to that, we need them to be creating new knowledge. We need them to be involved in thinking through the problems the way we solve them today and the way they can be solved in the future. So we're about research, and we're going to increase our research mission over the next several years. And then we have to transmit that new knowledge. So we are educators. We have to be the conduit of what's new and bring it to bear throughout the state, throughout the nation, perhaps throughout the world, of the best way to care for patients, solve problems, and then teach about it. The department is also going to be focused on several areas that we've begun. One is a weight and wellness center. There's no question that obesity is one of the biggest problems for the United States, but also for the world. Somewhere around 1/3 of our adult patients are now obese, and up to 2/3 are obese or overweight. And our children are not long behind. There's about a 17% obesity rate among children. And type 2 diabetes is approaching 20% in teenage years. We have to tackle this. We want our department to tackle this, bringing to bear all of the facets of a Department of Medicine that will work with the other departments of the Academic Medical Center to have a focus on weight and wellness. We know that if we focus on that, we'll do preventive care. It's making an investment now for what will be a payoff later for the health of our patients, but also for the costs of American health care. If we tackle that now, we'll be in good shape for later. I've been really delighted that Gregg Meyer joined our institution. He is a thoughtful, future-thinking clinician administrator, and I look forward to many, many years of working together with Gregg. We know that we have to curb healthcare costs, and I'd like the Department of Medicine to take a lead in showing how if we address some of the issues of major importance like end-of-life care, like weight and wellness, some of these issues will be cost savings. At the same time, they improve the quality of patients' life, help their families to deal with their situations, and it's just the right thing for healthcare in America. Gregg is going to position us well, both locally, regionally, nationally, to link us to the other institutions who are like-minded, and I look forward to working with him on so many projects for Dartmouth-Hitchcock. While I've taken on this role of chair permanently, I'm delighted to continue my clinical activities about 20% of my time, or a day a week. I'll still be performing endoscopies and seeing patients in the clinic, and I need that as part of my identity, but also to understand the practice of medicine as it continues. I'll also be able to continue my research. So one of the benefits of cutting back on patient care, yes, taking on these administrative duties, but freeing up time to continue my research. I've been funded continuously for over 25 years, and I'm delighted to continue to work on some really exciting projects, the most recent of which are the endoscopic control of weight, thinking about how we do incisionless delivery of devices or altering the stomach anatomy so that patients can lose weight without having to go through major operations or contend with pills or medications that really haven't been very successful. So we'll continue a lot in that area and in the whole area of natural orifice surgery. So many projects to come.